Imagine this. A patient's life is just hanging in the balance. The clock is ticking like crazy, the symptoms are all over the place, and their body is starting to shut down. This is a medical emergency that plays out in hospitals all over the world every single day. So let's dive right in and unpack the new global battle plan against one of medicine's oldest and deadliest enemies.
To really understand the fight, you first have to understand the enemy. So let's walk through what a classic case looks like, where a sickness that seems straightforward at first suddenly spirals into a total life-or-death crisis.
It all starts kind of subtly. A high fever for 4 days, feeling really weak. I mean, it's concerning for sure, but honestly, it could be 1,000 different things at this point. But then things start to escalate. You get this severe abdominal pain, vomiting. Suddenly, the whole picture is getting a lot darker, and it's happening fast.
A couple of days later, you see a truly ominous sign. The patient's urine output just plummets. And let me tell you, that is a massive red flag. It means the kidneys, the body's entire filtration system, are starting to fail. Then, in the final hours, the brain gets hit. The patient gets confused, drowsy, and their responsiveness just craters. It feels like they're slipping away right in front of you. And a look at the vitals, it's a physician's worst nightmare. The blood pressure has totally crashed to a life-threatening 80/40. That puts the entire body into a state of shock. So the million-dollar question is this: what on earth could be causing this terrifying multi-system cascade of failure? The answer is sepsis. And this isn't just some run-of-the-mill infection. It's the body's own defense system going haywire and turning against itself with absolutely catastrophic results. Okay, so let's get precise here for a second. The official definition of sepsis is a life-threatening organ dysfunction caused by a dysregulated host response to infection. Whew, what does that actually mean? Well, in plain English, it means your body's attempt to fight an infection goes completely off the rails and starts to attack your own tissues and organs. And this slide right here does a great job of showing that chain reaction. See, an infection kicks off this massive, widespread inflammation. That inflammation then messes with all the tiny blood vessels, which means your tissues aren't getting enough oxygen, and that ultimately leads to organ failure. It's a domino effect. And make no mistake, this is a massive global health crisis. Sepsis is one of the top killers for people of all ages, all across the entire planet. But here's the good news. There is hope. An international team of experts has just rolled out a brand new global playbook, a much more refined strategy to fight back, and to do it more effectively. I love this quote from Dr. Hallie Prescott, who was a lead author on the adult guidelines. It really gets to the heart of the new strategy. See, it's not just about being fast anymore. It's about being fast and smart. Aggressively treating sepsis, of course, but also being careful not to overuse powerful antibiotics and other treatments. What's so powerful about these guidelines is the incredible collaboration behind them. This isn't just one person's opinion. It's a huge joint initiative from the top critical care societies in both Europe and America. They brought together over 130 experts. And, this is so important, they even included patients and their families in the process, which led to 46 brand new recommendations for how we care for adults. This gives us the perfect 30,000-foot view. The new guidelines are really built around 3 key pillars: smarter detection, so we can catch sepsis way earlier, more precise and optimized treatments, and something totally new, a huge focus on what happens after the patient survives. So, how does this new playbook actually work in the real world? Well, the big idea, the central theme, isn't just about speed anymore. It's about being smarter, more nuanced in how we approach treatment. Now, this slide is really key because it shows just how much the thinking has evolved. Okay, let's take screening. We're moving away from older tools like Q-SOFA, which sometimes missed cases, to more robust early warning scores, things called NEWS or MUSE, that can catch sepsis much earlier. And that old one-size-fits-all approach of just dumping in IV fluids, that's out. It's being replaced by a personalized strategy for every single patient. They're even adjusting blood pressure targets for older adults. The entire focus is shifting from just managing the crisis to caring for the whole person. So, what does all this boil down to? Well, the ultimate goal is to deliver way more personalized care. This helps reduce complications that can come from overtreatment, like fluid overload or antibiotic resistance. But, and this is critical, without ever slowing down the speed needed to save a life. And now for what might be the single most important addition to these new guidelines, a dedicated focus on the long road to recovery. You know, surviving sepsis is a monumental victory, but the battle is often far from over. And for the very first time, these guidelines put a powerful focus on what happens next. They're calling for doctors to assess a patient's risk for long-term health problems, for dedicated follow-up clerics, and for support for both physical and mental health recovery. And why does this matter so much? Well, because a staggering 30 to 40% of children who survive sepsis might face lasting health issues. This is about making sure that survivors don't just survive, but that they can go on to live full, healthy lives. So what's the one thing you should take away from this entire new playbook? It's a message that's never changed, it's only gotten sharper. In the race against sepsis, every single minute counts. The real question now is, how quickly can this smarter, more holistic approach get adopted everywhere so we can finally turn the tide in this global fight?